this is for ABGs. So we have a doctor that's ordered ABGs on a patient. We're going to check the patient chart, make sure that that order is in the chart, and then we're going to look and see if they have any bleeding disorders or are on any blood thinners. If they would be, we would just need to hold pressure a little bit longer following that needle stick. So we would enter the patient room. Hello, Mr. Blank. My name is Trisha. Today we're going to get a different kind of a blood sample that the doctor would like to have today. Instead of your veins, we're going to take it through your arteries. It's arterial blood gases, and this just shows how well you're breathing today or how your breathing is affecting your body today. So we are going to go ahead and do that. I'm going to first check your arm to make sure we have enough circulation on the arm, and then we will, it's just a needle stick just like with your veins, the other way you've been getting your blood draws, but this is the forearm, a little bit down further from where you've been getting your other blood draws. So I do have my supplies. I have my needle and my gauze pad to hold pressure, alcohol pad to cleanse the area, my Band-Aid for afterwards, and then my cork and my device to remove bubbles afterwards. So first we're going to do that test to make sure you have enough circulation. So I do feel the artery on this arm here. I am going to occlude both your radial and your ulnar arteries. I want you to make a fist with your hand 3 times, release it, make a fist. And then I see the palm of your hand is blanching because I'm holding that pressure. And then open the palm of your hand, just relax it, and then I'm going to release pressure on the ulnar artery. So I release that pressure, I see your skin returning, the color's returning very quickly. We want that to return within 5 to 10 seconds. So we know we have enough circulation on that arm to utilize that arm. So I'm going to go ahead and cleanse that area here, rubbing in a circular motion for at least 30 seconds. Then I'm going to clean off the fingers that I'm using so that we don't contaminate. And I'll grab my syringe. With this, we're going to pull back at least 5 cc's, if not a little bit more, so that we can fill that syringe to get the amount we need. Uncap that needle. I am going to have you put your arm up on this little towel here. Sometimes if we extend the arm just a little bit, it will stabilize that artery, make it a little bit easier. So I'm palpating that artery. Go ahead and relax that arm. Make that poke at 45-degree angle with the bevel up. And then as I'm entering, I'm seeing the blood flow return. Just going to fill this syringe. It's going to be a little bit lighter than venous blood. So I'm going to fill that just over the 5 cc mark. And then we are going to put pressure as we release that needle. Put that needle into the cork there and hold that pressure. We're going to do 3 to 5 minutes on every patient. If it's a patient that is on a blood thinner or is anticoagulated or has any bleeding disorders, we would hold pressure longer, at least 10 minutes. So we've held that pressure, check the site, apply that Band-Aid to the area, and then we're going to remove our syringe from the cork and put that into our device to remove the bubbles and get that sample to a lab as quick as we can.